It's actually quite a natural emotion to feel lonely. And for many of us, under normal circumstances, when we feel lonely, we're actually able to do something about it. We can afford to go out or even invite friends to our homes. With COVID-19, loneliness and social isolation has become more widespread, but those who are already marginalised are now worse off. They are now further away from accessing both formal and informal support that's being set up. There's a massive digital divide as well. Lots of people not having access to digital technology to link up to these informal support networks. Many organisations use staff from other areas, and with the lack of transport available and the kind of social distancing and isolation measures, many people can't come into work and can't come into the areas where they're most needed. So there's an ever-growing need of local volunteers and localised support. What we're also hearing about in areas is that there's been an increase in alcohol, tobacco and drugs use as a coping mechanism during the lockdown. And a number of organisations that we've been speaking to also spoke about the increase in people reporting suicidal thoughts. As NHS staff are redeployed to help with COVID-19, there's a fall in what is deemed as non-essential healthcare. Now, this is adding to all the stress and anxiety of those people with existing conditions, those who are self-managing conditions, and those who have been recently diagnosed. And this is all going to have a very long-term impact. The third sector is showing an enormous amount of creativity, adaptability, and there's a lot of swift action in dealing with the crisis. We're hearing of organisations using their own funds to buy people that they support equipment such as tablets and phones so that they can stay connected and access support. But there's a lack of sustainability here. The implications of COVID-19 on people's health and well-being will transcend the duration of this pandemic. There is a need for long-term sustainability of these organic and formal forms of support to continue. And I think this needs to happen through long-term funding, through kind of society sort of restructuring itself and saying that actually we have a social responsibility and we need to give back so that we can become more resilient in times of crisis. We've had a range of policy legislation, Community Empowerment Act, community asset transfers, the place standard that helps local communities get involved with local decision making, the loneliness and social isolation strategy, A Connected Scotland, which speaks a lot about developing community resilience and fostering kind of bonds at a local level by supporting community infrastructure. So the rhetoric is there. There was no single policy or strategy that could make a difference, but that loneliness and social isolation, these types of issues, cut across a range of multidisciplinary and cross-portfolio policies. And what people wanted was an enabling government that recognised its role in delivering policies and strategies that tackled what they felt were socio-economic inequalities within our society.